Well, our top story today is with regards to the meeting that is currently on. In fact, it was scheduled for 3 p.m. this afternoon in the WHO headquarters on a decision regarding the booster dose for those who are fully vaccinated. Do they require another booster dose in order to consolidate the protection against the virus, especially now with the Omicron variant threat that has emerged? So the global health body, WHO Strategic Advisory Group of Experts, is meeting to discuss the evidence available right now on the need for booster doses and also the recommendations for the same. Currently, the WHO maintains that the evidence on the new variant is limited and there is no clarity if the variant causes severe disease. The meeting comes in the backdrop of a growing chorus for the need to start vaccinating vulnerable population. Some countries have already started with booster doses. India is yet to take a decision. So there are concerns over waning immunity for those who have taken the vaccine early in the calendar, and also concerns over the risk of severe disease. Now, yesterday, India's Scientific Advisory Group on COVID immunization deferred its decision on the booster dose after it failed to arrive at a consensus. The panel is waiting for the outcome of the WHO meet, which is why we are focusing on this particular issue right now. Here on the big story, the Scientific Advisory Group on COVID immunization says the decision is deferred on the issue of additional dose in the absence of consensus on whether there is a need to administer a booster to those at risk of infection or severe illness caused by coronavirus. So no recommendation has been made by this technical advisory group. Remember, India has vaccinated 85% of adults with one dose, 50% fully vaccinated with both the doses. So at the moment, what we are going to do is going to understand the importance or the necessity of the booster dose and the kind of developments that have happened on that front. My colleague Ayushman joins us. I am also going to introduce the experts on the show. Joining us today is Dr. Chandrasekhar, Chief Intensivist from the Fortis Hiranandani Hospital. Also, Dr. Rajiv Jaydevan, Scientific Advisor, IMA. Thank you, gentlemen, for joining us. We have two doctors on the panel, and we'll try and understand the exact implications of introducing a booster dose and what the WHO is considering today. But first, let me get in Ayushman to give us an understanding on the developments. Ayushman, first of all, take us through the outcome of the meeting yesterday, because that was a technical advisory group meeting precisely on this issue where nothing conclusive was announced. And right now, even as we speak, the WHO is taking up the matter. Over to you for the latest, please.
Well, the National Technical Advisory Group for Immunization yesterday met, and they clearly could not arrive on a consensus, and that's why the recommendation for a booster dose was not given to the Health Ministry. This is what the officials have confirmed to us. But the advisory group of WHO is holding an extraordinary meet today, in which it will be discussing the three aspects will be discussed. First is evidence and consideration for booster doses, and evidence assessment for over time, and at the same time immunogenicity, vaccine effectiveness, and safety of booster doses. So these are three different criteria which are being currently discussed, and it would be of about 2 hours meet that will be taking place in WHO today. This overall idea of the booster doses, if you remember, a month ago, the WHO had set a moratorium on the booster doses, saying the weaker and the poor countries don't have even access of one dose, and that's why it is not it won't be correct if a booster dose are being given in the developed countries. But with the Omicron, definitely that debate of having that booster dose has come back, and as a result of that, we are seeing the WHO's SAGE having an extraordinary meeting in order to discuss the effectiveness of booster dose. It would be important to see whether WHO arrives at a conclusion or not, because currently India has made it clear that as of now, the option for booster dose is not available in the country.
Okay, thank you, Ayushman, for joining us. Dr. Chandrasekhar, first of all, before we go into the exact understanding of the importance of a booster dose, I want to know that is India really bound to wait for a direction to come from WHO, or are we capable of taking a decision on our own with this regard? What is the opinion within the medical fraternity with senior doctors like yourself on this?
Farana, rightly you have brought up certain points already. That's the one is a scientific technical committee and advisory committee to the government that had not concluded anything. That meeting was inconclusive and it is waiting for WHO's meeting results.
Yes.
And the second point is WHO had rightly admitted the point that its effort in COVID-19 pandemic control is uneven and pragmatic because some countries are getting a good number of vaccines and they are sitting on the vaccine stocks, and some poor countries are not even vaccinated with a single dose. In that matter, our country and our government had done a significant work. At least 85% of the population had been vaccinated with a single dose. And even significant number of population, especially the frontline workers and healthcare workers, have been given a second dose also.
Yes.
Now, in terms of giving a booster dose and the Omicron variant, let me tell you that we are going through a pandemic after working for more than 2.5 years in the pandemic.
Yes.
Let me tell you that this would not be a last time this virus is going to threaten our lives and our livelihoods.
Okay.
And whatever have been learned through this pandemic, this must not be lost. And at least it is a big time gap for at least for the frontline workers and caregivers. Already they have taken their second dose of vaccine in the March. And with the variant or any variants coming up, in my view, at least they require a booster dose on a priority basis.
Okay.
And evidences are also there across in the public forum. January 30th, the NEGM had published across country booster dose vaccination in Israel have been published, a significant number of population and a big study, and immunogenicity and even the antibody levels titers have been monitored, and the good results with the booster dose have been published. And even the Lancet paper had published recently that UK-based co-boost trial. And even in this trial, they have gone to the extent that the swapping or cross vaccinating previously either AstraZeneca vaccine, now booster dose with another available vaccine they have done.
Okay.
And they have got a good results in terms of their antibody titers and the protection.
You know, this entire debate, Dr. Chandrasekhar, came up on the booster dose because INSACOG, the Indian SARS-CoV-2 Genomics Consortium itself brought up this issue. And that is when this debate picked up that isn't it time to introduce a booster dose, because INSACOG said people who are 40 plus should be taking it. It said low levels of neutralizing antibodies from existing vaccines may not be sufficient to neutralize the new variant Omicron, suggesting the booster dose. Then, of course, INSACOG said that they revised that decision and it went to the Technical Advisory Committee. Dr. Jayadevan, what is your view on it? Because, and also, is it necessary to go through it in a certain way, in a linear way, that first let's have the population fully vaccinated, then we go to the children, then we think of a booster dose? Or can it not happen simultaneously?
Clearly, these are questions that do not have a black and white answer, and that's also the reason why the advisory committees are unable to reach a conclusion. But for our viewers, let me simplify things to the extent possible. What are we trying to achieve is something that we should always keep in mind before we take up a decision. In the case of COVID-19 with vaccination, what we're hoping to achieve are two things. One, to stop the person from dying should the person pick up an infection, and two, to stop the person from picking up an infection altogether.
Yes.
Now, all existing vaccines are excellent at the first part. That is, if you take 2 shots of vaccine or 1 dose after past infection, you are well protected against severe disease, unless you're very unlucky or you have certain certain conditions that make you more susceptible. So that's one. The second part, though, most vaccines are injectable. All current vaccines are injectable vaccines, and they're not given into the nose or throat, which means that they don't really build a lot of immunity in the nose and throat. So it's quite natural for the virus, especially when increased mingling happens and when there's a surge, for people to pick up infections in the nose and throat. And that's what we commonly refer to as breakthrough infection. But the question is, are these breakthrough infections killing people or not? Now, breakthrough infections for the vast majority are extremely mild or without symptoms. But
Okay.
in a small subset of people, they do cause problems, and that's predominantly the older people and also people with certain associated disease conditions. And healthcare workers and frontline workers come under a special category because on an everyday basis, they are facing the virus, whether they like it or not. So there's a view that healthcare workers and frontline workers ought to get this extra booster dose. But as I mentioned, this booster dose is not going to further increase their protection from death. It will definitely reduce their chance of picking up an infection in the initial term. There's no doubt about that. But that being said, multiple vaccines are being used around the world, and most of the information we have now are on mRNA vaccines being used as boosters in Western nations. But in India, we don't have mRNA vaccines as boosters, and we have not used them as primary series. So that is where evidence becomes rather thin now. But what we do have is solid evidence on the ground that anyone who's double dose vaccinated is not picking up severe disease any more than they did in the beginning of the pandemic.
So there is no such thing, Dr. Jayadevan, just a small clarification, no such thing as the waning influence of that immunity for those who had taken it, say, in the early days, because that is another concern that is coming up. Am I protected indefinitely, or is there an expiry date for how long the double dose will protect me?
Yeah, on two fronts. There is on the first front, there is no waning, but on the second front, that is picking up the infection. All vaccines, they stop really becoming bulletproof within about a few months after vaccination. And that's just the nature of the virus. It's nobody's fault. But we don't have mucosal vaccines. We hope that we can get mucosal vaccines that can stop infection from happening. But the second aspect of immunity has not waned. I think our viewers must be very clear about that. If you are vaccinated, you're well protected from severe disease. But you want to stop yourself from picking up a breakthrough infection, which in some cases can turn severe if particularly they are older. And that's the message.
Okay. Dr. Chandrasekhar, your view on this. Is the Omicron threat relevant in this discussion for booster dose, or irrespective, the view is the same? Do you concede with what Dr. Jayadevan just said?
See, yes, Jayadevan had rightly addressed it, saying that, yes, we have a certain degree of persistent immunity against virus once we are vaccinated or once we have got infected or infection plus vaccination. Because it's a antibody titer also, antibody level also, IgG level also, and along with that, the T lymphocyte related immunity also. The T lymphocyte related immunity is expected to persist for the lifelong or for the longer time at least. But at this point of time, at least the scientific evidences, whatever they are showing, that the continuation of the mutation over the viral gene proteins, as the most of the vaccines are prepared or manufactured or research have been done depending on the gene or the spike protein types, and against that the vaccines have been prepared and antibodies are generated against that. And many more literatures and publications are yet to come, the cross immunity against the other variants and other genes, because there are many variations or many mutations are happening. Likewise in Omicron variant, there are 50 mutations. And really, whether we are immune to all the mutations that are they are taking place in these viruses. And even same time, Dr. Jayadevan also admitted that yes, we are going to get infected, but not a severe thing or not a deadly disease we'll get. But to protect ourselves from getting infected, whether we are going to come out with a newer vaccines with a new mutation in that vaccines,
yes,
or whether we are going to boost up our immunity, that becomes the big question. At least to boost up the immunity of the frontline workers, according to me, at this point of time, there should be a consideration for vaccinating.
So you're saying we can always identify a priority group and go ahead with the booster dose. There's no harm in it. Especially some states are already reporting that they have the extra stock available. Both the Serum Institute and the Bharat BioNTech are saying that there's enough supply. So there is availability of doses. So That part is there, but whether there can be a policy decision on this, we'll have to wait and see. Thank you so much, Dr. Chandrasekhar and Dr. Jayadevan, for joining us this afternoon. What I really want to point out here is that the opinion from the experts today is very clear that the current vaccines, the double dose, is good enough to give you a decent protection. So if you haven't taken the second jab, you need to go ahead and take it. And of course, COVID-appropriate behavior, uncompromisingly. Do wear the mask, follow social distancing, and hand hygiene. Of course, also another element added now to the protocol, ensure that you are in a ventilated area when you are in large crowds.